I will get it done in 2028 if necessary. If they continue down this path, and of course they can stop. They want to stop this game. They can stop right now, and we'll stand down as well. But until then, we're not going to be on the sidelines.
That's Democratic Governor of New York, Kathy Hochul, on MSNBC last night, saying she would stand down on a potential push for redistricting in New York if Texas does as well. Let's bring in right now Republican Congressman Mike Lawler of New York. He's a member of the Foreign Affairs and Financial Services Committee. Congressman, thank you so much for being with us. We're going to get to that in a second, but we've been talking about the problems that Republicans have had because of the so-called Big Beautiful Bill, which could also be called the bad budget busting, debt laden piece of garbage. Either way, 6 to 1, half dozen of the other, I suppose. I'm wondering how are the hospitals in your district going to manage with all the cuts to Medicaid that are going to be coming up? Because it's obviously some of them have already said it's going to impact them.
Well, respectfully, Joe, Medicaid is going to grow by over 24% over the next 10 years. What we focused on in the bill was rooting out the waste, fraud, and abuse within the system. Medicaid has more than doubled over the last 5 years in overall cost. And when you look at a state like New York that spends 83% more on Medicaid than the average of the other 49 states, that's a pretty expansive program. So this whole notion that is being fostered by Democrats like Kathy Hochul, throwing out ridiculous numbers about who's going to lose coverage or the impact on hospitals in New York, the fact is it's bunk. You look at the overall system in New York. New York has had serious challenges because of the mismanagement of its state by people like Kathy Hochul. New York State spending has increased by $100 billion in just 1 decade. So when you're talking about debt, when you're talking about budget busting, that's exactly what the problem is in New York. It's why New York leads the nation in out-migration. We simply made common sense reforms, making sure that illegal immigrants are not collecting Medicaid benefits. In New York, they are spending billions of dollars on illegal immigrants. So very quickly, you could adjust and move those billions of dollars to fortify the hospitals and the healthcare system in New York. Secondarily, work requirements for able-bodied adults without dependent children. That's something that you championed in the 90s, Joe, as part of welfare reform when you were in the House Republican majority. So these are common sense reforms. I have no problem defending it and articulating it.
Well, respectfully, Mike, the Congressional Budget Office, which obviously is a part of the institution where you serve, says that there's going to be about $900 billion to $1 trillion in Medicaid cuts. If you look at the hospitals in your own district, Montefiore Nyack Hospital is already saying, because of that vote, because of these cuts, they're going to have to cut back services. They're going to have to cut staff. They're going to have to cut care. Same thing with Westchester Hospital. Hospitals across your district are going to have to cut services and care and staff members and budgets because of your vote and because of this bill that passes. That's what they're saying. It's not some left-wing focus group or some. Well, I'm just telling you what they've said, so
what they're parroting is the same talking points being put out by the state and by the
so they're parroting. You know their business better than you know their business better than they know their business. Congressman, you can keep talking if you want to,
Joe.
But are you saying that they know, you know their business, you know doctors' business, you know hospital administrators' business better than they know their own business? Is that what you're telling us here?
No, Joe. If you'd stop putting words in my mouth and let me answer the question. Number one,
you said they were parroting. You said that actually they were having the words put into their mouth. You said they were parroting other people's words.
Go look what they've actually put out and it's all the same. It's all the same points that the Greater New York Hospital Association and that the state of New York are parroting. But the bottom line is, and I've met with all of them, they have had significant challenges because of the way the state has managed the Medicaid system in New York. Montefiore Nyack is a safety net hospital. 85% of its funding comes from Medicaid and Medicare reimbursements. The state has cut them off for years, refusing to give them the funding that they need through various programs, and instead telling them, go to your parent, Montefiore Health System, based out of the Bronx. So we can get into the challenges that Montefiore Nyack or Westchester Medical Center are facing. Many of them stem from the fact that the state has mismanaged its Medicaid system for years. Okay, so I'm more than happy to have that discussion. I've had it with the CEOs of both Montefiore Nyack and Westchester Medical. We fought in this bill to help Westchester Medical with respect to state-directed payments because the state failed to submit the state-directed payment in time. So I was able to secure a change within the bill to help them.
You're saying then, again, and I'm not putting words in your mouth, you say they're just parroting other people's words. They don't really know what they're talking about when they're talking about how your vote hurt their hospitals, that it's actually Kathy Hochul's fault. Is that the bottom line before we get on to redistricting?
What I'm saying, Joe, is they're all parroting the same line from the state of New York and Greater New York Hospital Association. But when you actually drill down on the specifics, many of the challenges that our hospital systems in New York have faced actually stem from the decisions made by New York State over the past few years. New York has the most expansive Medicaid program in the country. Okay, Medicaid growth year over year, it's going to be about 3% per year. Medicaid over the next 10 years is going to grow by 24%. So this notion that Medicaid is being gutted is not true, number one. Number two, there is going to be continued growth within the system. New York needs to do a better job of actually managing its Medicaid dollars.
All right, Claire McCaskill has another question. I will just say again, Claire, the Congressional Budget Office says that there will be cuts between $900 billion and $1 trillion. Montefiore Nyack Hospital has already complained about staff layoffs, reductions in services because of these budget cuts, and have grave concerns about the quality of care and services. You could look at Westchester Medical Hospital. You could look at Good Samaritan Hospital. You can look at all of these hospitals in the congressman's district. And it's not just Mike's district. It's every congressman's district. You will be hearing this from every hospital across America because, you know, if you listen to the debate on this deal, it sounded like they were only taking health care away from, you know, pot-smoking, hacky sack-kicking hippies who refused to go to work at 28 and were able-bodied. The fact is, the gutting of this funding stream, at the same time billionaires are getting massive tax cuts, the gutting of all of this actually has an impact on hospitals and their care and services for young and old alike.
Yeah, and Joe, let's quit talking about talking points and let me ask the congressman a very simple question. If a human being in his district is in a really serious car wreck or is a victim of a shooting and they show up at the ER of one of the hospitals in your district, do you believe under the laws that are currently existing that that ER has to treat that person?
Yes, of course.
Okay, so let's assume that that person, because they had to sit on a phone for 2 hours trying to prove every 6 months they're working and they couldn't get through, or because the paperwork requirements are so onerous, which we saw happen in Kentucky and other places where they installed work requirements. Let's assume that person works a minimum wage job, 50 hours a week, and they haven't been able, because of the bureaucracy, to verify their work, or if there's someone who is waiting for an immigration hearing. When they go into that hospital with a dire trauma, the hospital has to treat them. Who's paying for that with these cuts?
So again, one, you're making a lot of hypotheticals, but two, you're also
No, this
assuming
is a
that
real-
people
no,
are.
no, no, no,
You're
no, this
also
is not a
assuming. No, no,
hypothetical.
no. Respectfully,
This
Claire,
really-
you're
this
also
happens
making.
every
Yeah, I know.
day.
You're making hypothetical assumptions. Number one. Number two, you're assuming people are too incapable of managing the system. The fact is, New York is going to administer the work requirements that will be enacted, which go into effect in 2027. We're talking about able-bodied adults without dependent children.
Okay.
We're not talking
So
about
what if
people.
somebody
We're not
doesn't do it?
talking
What
about
if somebody-
people.
I'm not
We're not
asking about
talking
that,
about
Mike.
people who.
I'm not asking
well,
about
great,
that.
Claire, but I'm going to
asking-
answer the question.
I'm
So you can
asking-
sit here and
no,
argue with me
who
all you
pays
want.
for it?
But the fact
Who
is,
pays for
yeah.
it? Who pays for
The
it?
state
now.
of the
Alex,
state
Alex, come
of
to me
New
right
York.
now. Come to me right now. Come to me right now. We don't do this. Claire's going to ask a question. Mike, you'll have time to respond to the question. All right? But none of the crosstalk. Claire, ask your question, and then Congressman, respond. Claire, go.
When an uninsured person, when a person who no longer has Medicaid shows up in an ER with a dire trauma, the hospital has to treat them. They have to go into their reserves to treat them. They then pass those costs on to the insurance companies that they charge for services. They pass those costs on to other places in the system. They have to. And when they do that, Mike, that means people's insurance rates go up, because they're having to pay more for their health care because the hospital is required to treat people who show up with dire trauma. That's where these painful cuts are going to be felt. They're going to be felt when hospitals have to absorb the costs for uninsured people. Now, if you want to change the law and say that somebody who shows up in an emergency room, if don't have insurance, they can die, then you can do that. But otherwise, these hospitals, that's why these hospitals are panicking. And the ones that are in rural communities, not like your district, it's a swing district, but those in rural districts where there's very little chance of any room for error with their budgets, because they run so close, pardon the expression, to the bone in terms of their budgets. That's why these rural hospitals are in a panic, because when someone shows up uninsured, they still have to treat them. That's the problem I wanted you to address, not whether able-bodied people could work or not,
So
whether or not
that's-
this program's being run well, but who absorbs the cost.
All right, Congressman, go.
Okay, great. You identified a issue that has been consistent in time immemorial within our hospital systems across the country. And you answered your own question as to exactly what happens. But the fact is that the state of New York, as it has, regardless of this bill, will continue to operate in the same manner that it does. And the same way that the hospital system has had to address these challenges along with the state will continue. That leads to a bigger point, which is that even with the Affordable Care Act, okay, that you voted for, you supported, passed 15 years ago, the reality is the economies of scale that were promised under the Affordable Care Act never came to fruition. And in fact, cost has exploded within our healthcare system. And in fact, premiums have gone up. Your bill that you supported 15 years ago promised to address all of that. It failed miserably in addressing that. And the fact is we have a workforce shortage as a result. There's been great consolidation. And I can tell you within my region, within our hospital systems, every major New York City hospital system comes into my district. The consolidation that occurred and the promises of economies of scale have not come to fruition. The overall cost of our healthcare system has exploded. So we all should want to address that. We should all want to ensure access. We should all want to ensure reduction in cost and make sure that people are able to get the care that they need. But this has been a big problem that has been festering long before the passage of the One Big Beautiful Bill. And you can look at every healthcare system in New York, every hospital system in New York. They have been struggling for years. I can sit here and go through chapter and verse all of the problems that have stemmed from the decisions being made in New York. And that's just a reality of the healthcare system.
Yeah. All right, Jonathan Lemire, a couple really quick things. Claire's point was, if you take away Medicaid funding and you take away coverage for people. They still show up at the hospital, and then the hospital is having to take care of them. They're not going to get reimbursed, so that expense gets passed along to everybody else. There is no free lunch in healthcare. I will just say this point: the further and further we get away from Obamacare, it seems the biggest problem with Obamacare is that it didn't go far enough. You look at insurance, private insurance, and the profits that are being raked in by private health insurance companies, and the coverage denial that continues, denying, some reports are by AI, using AI to deny as much coverage as they can cover, making it harder for people to get to their doctors. Yeah, we have a healthcare crisis for a lot of reasons, but not because the poor are getting a free ride. We have healthcare problems in large part because we have a lot of multinational corporations, a lot of insurance companies that are making billions and billions of dollars denying health care coverage to those who need it most.
Yeah, no, all of that is right. It's a crisis, continues to get worse. Congressman, we are going to return now to redistricting. It's certainly this push in a number of states to redraw the maps started by Republicans aiming to do so in Texas. You have said you don't approve of that effort in Texas. You have also said you don't approve of the possible retaliatory redistricting in your home state, in New York. So let's set that aside. Let's just go big picture here in terms of what the country would lose if we no longer would have a Republican representing a district in a blue state, a Democrat representing a district in a red state. Jonathan Martin of Politico wrote a very good column this week about how people like you won't exist anymore because they'll just be wiped out and these states will just simply be red or blue. Doesn't the nation suffer if that happens?
Let me just make one point to follow up on Joe. When you have companies like United Healthcare owning primary care physicians like Optum Health, there's a problem. There's a fundamental problem in the system. I think we can all agree on that. That's not something that should happen. And that's, in large measure, a result of the Affordable Care Act and some of the consolidation that we've seen. With respect to redistricting, let's look at this holistically. New York State actually started this process of mid-decade redistricting last year. For Kathy Hochul to sit there with a straight face and say that this is in retaliation, it is not. New York redistricted its maps last year with a court order because they were so upset that they lost 11 seats in 2022 on a fair map because they got thrown out in court for gerrymandering New York's maps and violating the state constitution. I was executive director of the state Republican Party back in 2012, 2013, when we pushed for a constitutional amendment to require independent redistricting, ban gerrymandering, ban mid-decade redistricting. Kathy Hochul has done everything in her power to circumvent that in 2022, again in 2024, and now she wants a third bite at the apple. What Texas is doing is wrong. I've been very clear about that. What Democrats wanted to do in Wisconsin earlier this year was wrong. The whole Supreme Court fight in Wisconsin was about redistricting, and they wanted the court to order a new set of maps. The court, thankfully, said no. So this is a problem that has been happening for decades. Both parties are guilty. They do not have clean hands in this mess. And it needs to stop. It's why I'm introducing a bill to ban gerrymandering nationwide and to make sure that the redistricting process is actually fair. If you look 3 decades ago, you had 100 competitive seats in Congress. Last November, only 35 seats were decided by 5 points or less. 35 seats in the whole country. Mine wasn't one of them. I won by 6.5 points. And I'm representing a district that Kamala Harris won. So when you look at the challenges facing Congress, the challenges facing the country, the lack of competitive districts, it is what has created this partisan divide because you don't have people who are focused on a general election. They are solely focused on a primary, and that is at the root of the problems we're facing in Congress.
Republican Congressman Mike Lawler of New York, thank you very much. We really appreciate your coming on the show this morning.
Thanks for having me.